Okay, let's go ahead and get started. My name is John Lohman. I am the publisher of the Corridor Business Journal. I want to welcome you to our Corridor Rising 2.0 webinar series. As most of you know, we at the Corridor Business Journal host a lot of events throughout the year. And this coronavirus has obviously impacted our business model. New things, we are evolving, and one of the things that we have started this week was a new webinar series to keep our readers and our friends and the general public informed and connected. And we will be hosting two of these webinar series each week, one on Tuesday at noon and Thursday at noon for the month of April. We had a great one on Tuesday with some experts from CEC talking about telebusiness, which is obviously what we're doing today, and a lot of folks are incorporating that into their daily lives right now. And today we are fortunate to have Dr. Tim Sagers with us. Dr. Sagers is somebody I consider a friend. He's also the medical director of Mercy Care Business Health Solutions. He's a passionate healthcare provider, and he's got a great sense of humor, and we need that desperately at this time of with this crisis. And so we're very fortunate to have him with us today. We are also streaming, I think, live on Facebook for the very first time. So welcome, Facebook folks. We do want to have this an interactive discussion. So Dr. Sagers and I will be I'll be asking him questions, and he'll be answering those questions. And if any of you who are registered via Zoom have questions, you can type those in the chat or the Q&A section, and we'll try to get to as many of your questions as possible. But again, Dr. Sagers has been practicing primary care with Mercy Cedar Rapids for 15 years. He's a wealth of information, and I thought we'd start first, Dr. Sagers, by thanking you and all of your colleagues for all of the hard work that you're doing now and will be doing for the foreseeable future. So thank you so much for that. And I wonder if we could start with, maybe you could just give us a general update on the COVID-19 in Cedar Rapids and the corridor, and just how this pandemic is impacting your life as a healthcare provider.
Sure, and thanks, John, and thanks for all of you for being online. And I know that this is a, excuse me, a really difficult time for anybody, no matter what you do for a living or what your situation. So I appreciate taking the time. We are all in the midst of something that none of us could have predicted or planned for in some ways. We're all struggling to get through this together. I would be a cad if I didn't start my comments by thanking everyone for their support. The support that's been thrown towards healthcare during the last couple of weeks, and what we do in the light of this crisis has been just overwhelming. That's really what's kind of keeping us all going right now. Many of us who've been involved with the planning and the response to this from the beginning, we've been working hard for well over 3 weeks now, trying to prepare and build adequate response with the healthcare system. I will say this as a word of encouragement. We're lucky where we're at in the corridor. We have several really good health systems. We've worked together well. There's been a lot of ongoing communication. I can speak more detailed here in Cedar Rapids with Mercy and Unity Point St. Luke's are in constant contact, that meet every day. So there's been some really good work going on behind the scenes to keep the system functioning. We do certainly understand that we will experience a large surge in patients, both outpatient and hospitalized. Our modeling right now suggests that probably occurs around April 24th or so. That's kind of the date we're using as our really busy date. But we have a lot of good things happening. I know there's a lot of talk out there about supplies, PPE, and shortages. We're doing okay here right now. There's some things we're watching and worrying about. We have some really aggressive conservation measures in place for all of the stuff we use every day, just preparing for what's about to come. I know that as of this morning in Iowa, I think I wrote down some notes here, 549 cases. I think there's still 50 plus patients hospitalized. And last I knew, we had lost 9 patients statewide to COVID-19. That may have been updated since this morning, I'm not sure. much like other parts of the country, we're seeing younger people involved with the disease. You know, I think for a long time before COVID-19 arrived on our shores, we had thought that this was a disease that really got older folks. We're finding out that's not the case. Certainly older people and those with chronic health conditions tend to have worse outcomes with this disease, but it's an equal opportunity disease, unfortunately. The only good thing about it, we haven't seen a lot of disease in really young children, so that's been nice. COVID-19 is playing out to be everything we thought it would be. As many of you know, it's a simple viral illness. It's one of 7 coronaviruses. We live with coronavirus all the time. Most of you on this call get coronavirus once in a while. It's called a common cold. This one's just nastier. There's still some big misconceptions out there about what this thing is. It's a bad disease. It's not a hoax. It's not been overblown. It's real. To put it in perspective for all of you, especially if there's anybody on the call that's a doubter, this disease is about 20 times more communicable than influenza. It's about 10 times more deadly. With influenza outbreaks every year, about 1 in 100 patients will get hospitalized for influenza. With COVID-19, about 15 in 100 will get hospitalized, and many of them, about half, require ventilators. And that's why you hear the big talk, the big concern, and the push to get more ventilatory support to hospitals. So that's kind of what we're up against. We're holding our own here right now. Like a lot of things in Iowa, we kind of, in the middle of the country, we're a little insulated for a while, but it's made its way here. In our ambulatory clinics, we're seeing a lot of COVID. We don't, in Cedar Rapids, do a lot of commercial testing. For the most part here, the testing is based on the Iowa Department of Public Health criteria. And so there's only a limited number of patients that are actually tested for COVID-19, but there's been a lot of what we call presumptive or assumed diagnosis based on clinical history and evaluation. So there's a lot of disease here. It's here. Don't wait for April 21st to behave. It's here. And I know a lot of those of you in business on the line have already made some taken mitigation measures, change your business model, move patients to home, and we're going to spend some time talking about that. But from a healthcare standpoint, that's kind of where we're at, and that's kind of what we're preparing for at this time.
Are there any telltale signs that someone has COVID-19?
Yeah, if you're sick right now, you probably have COVID-19. That's a little tongue in cheek, but you have to assume, I mean, this is all at this point with infectious disease and the way that viruses behave. And you've all seen, if you've read anything or watched anything, you've heard about this steep bell-shaped curve that happens, that biologic bell-shaped curve that's real with viral illness. And at some point, you get to some point on that curve where there's enough penetration or prevalence of disease in a community that when people are sick with symptoms, you have to assume that they have COVID-19, and we're approaching that. The telltale signs and symptoms, it can act a lot like influenza. That's headache, fatigue, body aches, cough, congestion. There's some more interesting symptoms with it as well. And if you've done some reading or watched TV, they talk about diarrhea and GI symptoms. In fact, some patients, their biggest symptom is a GI-based symptom like diarrhea. There's also been talk about the loss of taste or smell or an alteration in the taste sensation, and we have seen that. That's real. So those things are very interesting, and those aren't generally part of an influenza presentation that we see every winter in Iowa. But for the most part, people just feel profoundly fatigued, really run down, congested. Some people have trouble eating and drinking. They feel so poorly. I've worked in our respiratory clinics. I've seen these patients at both sides of this spectrum. And there's some people that are mildly ill, and there's some people that just look terrible, like the worst influenza you've ever seen. The warning sign we watch for and we ask patients about is, are you short of breath? And there's some pretty good evidence out there that patients that have a little more severe form of the disease tend to become short of breath. In fact, what gets these patients into trouble is they develop respiratory failure. And that's why they end up on ventilators. Their lungs just get taken out by the virus, for lack of a better phrase. So those are kind of the classic symptoms. Unfortunately, like this virus isn't bad enough, it's also sneaky. There are patients that are positive and carrying the virus, shedding virus and spreading it, who really don't have any symptoms, or their symptoms are so mild that they're dismissed. So that's why I think it's important for all of us right now as we enter this this phase of our experience with this disease. If people are sick, you just have to assume that's what they have and treat them like they do, and work hard on self-quarantine and restriction.
So, Dr. Sagers, there is a question from the audience. It says the presumptive numbers that were mentioned, those are not included in the totals for the state, correct? Is that correct?
Right. Yeah. The state number you see reported is confirmed cases. Now, that's not just state of Iowa testing through the hygienic lab. Those include outside commercial tests like Quest or LabCorp that were sent somewhere else, but those are mandatorily reported back through the state. So those are confirmed cases of disease. And that's, I think we get in trouble with that because early on people think, well, there's only one case in my county, or there's only 27 cases in Iowa. We know that true disease in the setting of these viral outbreaks or pandemics exists tenfold or more at any given time. So the true prevalence of the disease is much, much higher.
So can you just give us a little perspective? You've been in the healthcare field for 20 years or so. Where does this rank in the challenge that you've been involved in over the years?
Well, I've never seen anything like this. I don't think anybody has. John and I were talking before we started the video here about, wouldn't it be nice just to have a little bit of a flood? That was easy. That was an obvious enemy. That was somebody we knew the water would go away and we could fix things. This is unlike anything anybody's ever seen. I think if you watch TV and you watch the experts like Dr. Fossey and other people that we rely on for information, I mean, nobody really knows how to respond in some ways. And a lot of it's because we don't know about this virus. When you see the word novel in front of COVID-19, it means we don't know it. It's new. We don't know, we don't know how it's going to act. We don't know truly about immunity. We don't know about reinfection. We don't know if this will be seasonal. We don't know if we'll see a second wave. We've learned some from Europe and Southeast Asia and other places where there's been a lot of disease, but we still don't really know. And that's been the really difficult part of this. On top of it, I think the most overwhelming thing for healthcare with this is we can't turn anywhere for help. Everybody is in the same boat. Every health system, every hospital, every clinic system is struggling in the same way. We all need the same supplies. We all have the same shortages. We all have workforce safety issues. When we had a flood here, we could turn to 30 other hospitals, move our patients around and get all the resources we need. That's not an option right now. So we're all kind of swimming upstream, and we're all kind of, as much as we are supporting each other, we're kind of fighting for ourselves in some ways.
So another question from the audience, how does this compare to H1N1?
In some ways, the preparations are the same. It just wasn't as widespread, and the lethality is different. But we've taken things we've learned from H1N1, things we've learned from the Ebola threat, which in the United States, fortunately, didn't materialize in any significant way. But we immediately adopted some of the things we learned from those outbreaks and implemented those immediately, and then we built on that as we move forward. So this is an animal of its own. I refer to this as a biologic war, and that's what it feels we're in right now. It feels like we're in right now. But this is a very, very different situation.
So what can we do as individuals and business owners to help with this, besides, of course, doing the hand washing and giving people the opportunity to work from home and social distancing? Are there other things that we ought to be doing?
Yeah, I think, I've been really impressed with how people have kind of grabbed on to some of the government and agency recommendations about self-restriction, social distancing. Most responsible businesses have really done a good job of closing doors, getting employees home. Even the restaurant and beverage industry is, they've made ways for us to get some creature comforts and yet try to keep us safe. There's still a lot of businesses out there that are, I think, kind of not pushing real hard on this, and it's going to be real important. I mean, we have one opportunity to flatten that bell-shaped curve, and I would argue very strongly that we're nearing the point where we're not going to be able to flatten that much more if we don't get a little more stringent in our restrictions. I'll be honest with you, I fully support a complete shutdown. If I could talk to the governor right now and she could grant me one wish, I would say shut everything down. And I know there's politics and policy around that, but the only way that we can mitigate right now is to limit exposures. I got home last night and finally had time to go for a run. And I ran down along the river and ran past 8 kids standing in a group smoking some weed together about 2 feet from each other. You know, it's just people aren't following the rules. I just don't think that people really understand what this thing is. They soon will, because it'll affect all of us in some way. But I think businesses, if you've already sent people home with remote work, or you've closed your doors, those are important moves. If you think about where we spend a third of our time together, it's at work. So if we can mitigate exposure there. I think the other thing is individuals. I think people understand they can't go out and they can't go to a bar and have beers with their friends. But having 6 of your family members into your house is just as dangerous. If you're grandparents and you like to babysit your grandkids, now's not the time to do that. Even self-restriction within the home is critically important, especially people with children. Small children are great vectors of this disease. Fortunately, they don't get sick a lot with the disease, but they do spread it. And so even within homes, practicing good infection control and social distancing is really, really important. We joke a lot. My wife doesn't let me come into the house with any clothes on anymore. I have to change in my garage when I come home from work. I mean, that's how serious we take it. And I encourage everyone to do that. Those little things can make a world of difference. If you think about it, if the average person is infecting 4 people, it doesn't take too much point contact change to make a big difference with this.
So we're gonna dive into, you know, the overall topic, which is helping stressed out and isolated employees and family members. But before we do that, you know, you talked a little bit about locking everything down, and I think that makes a lot of sense. But what does that mean to you? You know,
well, I'm sensitive to the fact that you just can't shut society down. I think there are things we can do with travel in some ways. I think there might be better ways to even watch state borders. I do think, I mean, I love the hardware store, and I drove by the Lowe's on Blair's Ferry Road the other day, and the parking lot's 3/4 full. I mean, we aren't gonna tampen or lessen that curve if we don't do something about that type of aggregation of human beings. And I worry a little bit about, and I'm sensitive to business. Look, medicine's been hit by this too. Everyone thinks medicine's really busy and everything's going crazy. We're not. I mean, we're taking care of sick people, but the rest of our business has dropped off dramatically. Hospitals aren't doing surgeries, procedures aren't being done. So this affects us as a business as well negatively. So I understand what that means, but there's a lot of businesses open right now that I would argue are not vital to our survival right now. And people are congregating in those places. You know, even parks, like I mentioned last night, one nice thing about this, I see more people out walking or riding bikes, but when you do that with a group of 6 of your neighbors, that doesn't make any sense. And so if there can be stronger wording or stronger language or direction from our government about the size of groups, 10 is too much. I mean, groups of 2 is enough. And so things like that, if we could get a little more strict in that. And again, I don't pretend to understand how you enforce those things. If we do, I'm not a fan of martial law. But if you look around the country or around the world, actually, where some of these changes have been made, it's made a difference.
So, you know, this is the $10 million question right now. How long do you feel we should be shut down? If we're going to peak, you said, I think around April 24th or something like that. Is there, in your crystal ball, when can we be operating again? Not necessarily back to normal, but operating again.
Again, I can give you my guess. I'm not an epidemiologist. I'm not an infectious disease expert by any means. I read a lot and I hear a lot and I go to a lot of meetings. You know, the question is, what does the virus do a month, 2 months post-peak? We've seen some other evidence from other countries where there's a little bit of a bump again in cases as restrictions are released and people go back in contact. We don't know how the virus behaves. And one of the things we don't know is how long people actually can communicate the virus. We know the incubation period's probably 2 to 14 days. I think right now we think the average person walks around 5.2 days before they start showing symptoms of disease. And during that whole time, they're shedding virus and making people sick. But we also know from other parts of the world that if you sample the respiratory tract from people weeks after they've had this disease, you can still find the virus. Now, we don't know if that means they're still spitting virus around or shedding virus and communicating it. And we're trying to learn more about that. We also don't know about immunity, and we don't know how many people, even here in the US, if they've been sick with coronavirus, are going to get it again. We don't know about reinfection. So it's hard to predict for sure when we come down or when that true tail of that curve happens. I would argue if we expect the middle of April or a little later to be our peak, that we have, you know, another 4 weeks after that to recover that curve, in which time there's still going to be a ton of sick people and a lot of disruption. You know, people ask that question all the time. When do you think that society will open up? When can we go back to work? I honestly don't know. Myself, I think that's June 1st, just based on what I know, or maybe late May. And at that time, there still may be some restrictions required. We just have to see what we do with this curve. And I think we're in a critical time period here to do more or be more aggressive to kind of tamp that down. But it's going to be a while. People ask me all the time about school. My own gut feeling on this is that kids aren't going back to school this spring. I just don't see how that happens right now. But hopefully I'm wrong, and hopefully we can really smash this curve and make some good inroads into infection control. And I'll be wrong. And the next time we talk on video, I can look at you guys and apologize. But that's how I feel right now.
Okay, so let's dive into the topic of helping employees that are feeling particularly stressed and isolated. You know, just from your previous comment right there, this could be another 2 months possibly where we're really isolated. And so, you know, what advice would you give to a manager, a small business owner that are trying to be supportive of employees, but they are very stressed about whether or not they're going to be able to keep their jobs, or if there's people that are particularly isolated? What advice would you give to these small business owners and the public in general to help prevent this from getting worse?
Yeah, it's a great question. And I know a lot of you are already dealing with this, both as employees or as employers. And I know that because we've already fielded a lot of calls, not just from patients or employees, but from business owners looking for advice on how to deal with this. I mean, we're only a couple weeks into this thing, and this is already a problem. I will say one nice thing I'm realizing about this: we've relied on technology to keep us going through this, but I think one thing we're finding is we still really like people, and we like to be around people. So maybe when this is all over, we'll spend less time on social media and more time with each other, being people again. But the one thing I think that's really important is you have to be, in your response to your employees with this, I think I'd call it the 3 C's, I guess. You have to be really clear in your understanding of the situation and what your company's response will be. I think you have to be credible. By that, I mean, you just don't use your opinion. When you make decisions that affect the lives of your employees, are we going to send you home? Are we cutting your pay? Are we laying you off? Are we furloughing you? All those things, that you use good information, reliable information. And then don't forget about the comprehensive nature of this thing. I mean, this almost overnight, this thing has disrupted every single aspect of American life. And for employees, they're worried about their job. They're worried about having money. They have to take care of kids that are home. Many of them are caregivers for elderly adults, or adults they're caring for now full-time. They have to worry about the health of themselves and their family. Some of them have been sent home to work from home, and they don't really have the technology at home to support that kind of work. And so those things, I mean, to really think about every way this affects your employees. And I certainly understand that the average employer can't fix all those things and can't be responsible for all those things. But anything you can do to meet those needs will go a long way, even in the short term. And I think one of the biggest things as employers to think about is, how can I structure a work life for my employees, especially those working from home, that most resembles the average day? I mean, looking for some kind of normalcy and consistency. And I think that's been well demonstrated with many crises and catastrophes and pandemics around the world for a long time. And that is, if you can find a way to make life somewhat normal. So, if you're an employee who has patients, or I'm sorry, I use the word patients, I get stuck, I'm a doctor. If you have employees working from home, how can you make their work life normal? I mean, can you do regular meetings like you do in the office? Can you have budget meetings like you do in the office? Can you meet with the supervisor every week like you do? Can you make sure that your supervisor and leaders are dealing with the direct reports every Friday at noon like they always do, although by video or other technology? Maintaining that schedule gives us some idea. The other thing is the quality of the work. I know a lot of people are sent home and they're just, I've talked to employees or patients who've said, yeah, I'm working from home and I don't really have much to do. If you can find ways to make the work meaningful, objective, if you can find ways to build some fulfillment in the work, even if some of the work that you're supporting is to go to support healthcare or local charities or other people, people want to contribute, they want to help, and they want to do meaningful work, whether they're in the office or they're at home. And I think those are really important things. The other thing I would stress for employers is be really aware of the mental aspect of this and the psychiatric aspect of this. We're already seeing that. 2 weeks into this, we already are dealing with that. So I'm a little concerned that 6-8 weeks from now, we're going to have another epidemic on our hand, and that's going to be the mental fallout from this thing for all of us. I know I'm already halfway there. But thinking about what services you offer, maybe ramping up your EAP offerings or your counseling or support services for your patients, or for your employees, I'm sorry, would be really, really beneficial at this time. And the other thing that we see happening, and I just had a conversation with a business owner this morning, and he is encouraging, as part of the work day for his employers, that there are certain work groups every day have to spend an hour on a video chat together. They don't even have to talk about work, but he wants the employees to be together, to see each other, to talk to each other, and keep the relationship alive. Those are really, really basic things that most of you can do right now. And we can talk a little bit more, John. There may be questions about, what about people who are still working? I'm a business and I'm essential and I'm operating. What do I do with my employees here? We can certainly talk about that as well.
So what about going for a walk and going for a run and encouraging your employees to get outside? And, if you can, there's some statistics that the stress level goes down 20% if you go for a hike into the woods. And so, can you talk a little bit about that and some of the physical exercise in addition to the mental that's so important at this point?
Yeah, that's really important. Obviously, gyms and fitness facilities are all closed at this time, but yeah, absolutely. I mean, and you see a lot of people out. I mean, one of the cool things about this is I drive around, I see more people out walking than I have in a long time, and that's great. I mean, as a doctor, I want people exercising. I don't want 100 people on the same little trail in the park. That's risky too. I mean, if you aren't maintaining your 6-foot exposure limits and things like that. But walking, running, biking, especially if you're alone or if you're with your spouse. My wife and I went walking the other night, and she walked behind me a few feet. It sounds crazy, but that stuff's really important. But I highly encourage that. And I worry a little bit if you see on the news, there are municipalities and governments around the country that have shut down parks. Now, many of these are parks that are highly used. So there'll be hundreds of people present in a park. That's too much, but we have a lot of room and a lot of open space here to walk, even if it's just in your neighborhood. It's interesting. I see people walking down the street in my neighborhood, which is a pretty quiet neighborhood, and people will go to the other side of the street to avoid the other walkers. That's not crazy right now. That's just smart. And so, yeah, encouraging exercise, that kind of thing. If you can have your employees build that into the workday, that's really important too, because I think what we're seeing on the news last night, I read that alcohol sales were up like some big amount. That's how a lot of people cope. I don't think that's the best way right now, although I get it. I think promoting exercise is a much better idea. Yeah.
So, if you see an employee every day and you can tell that they're down, you're more inclined to be able to help them because you can sense that they're not doing well. But if you aren't having that interaction with them in an interpersonal standpoint, are there telltale signs that people are overly stressed or feeling isolated, or heaven forbid, this really continues for a long time and businesses fail and, I hate to see where it goes next?
No, right. No, that's a great question. And, one of the ways I think, and we've been promoting even within our organization that our leaders, our clinical leaders, our uh, managers meet regularly with their teams, whether it's by video or in person at appropriate spacing, and just do a huddle. And even if it's every other day, just, hey, how are things going? Anything we need to talk about? It's a great way to get eyes on your staff. When I'm in my clinic, I do that. It's a great way to see how things are going. Things to watch for. People that normally aren't angry and are angry. People that normally engage, talk, and are actively part of conversations are withdrawn. People that normally come to work and aren't. Now, if they're sick, that's great, but if they're not, that's a concern. Most effective managers and business owners and leaders watch productivity and work. If that starts to drop off substantially, if there's any evidence of increased drug or substance abuse, those are signs that people are finding other ways to cope with their stress. I just read some stuff yesterday from one of the human resources journals about monitoring absenteeism as a way to know how people are doing. The problem is right now people are self-selecting too. I mean, a lot of people are afraid to go to work. A lot of people are afraid to leave their house because they're afraid that they're going to get COVID-19. And so that's a little more slippery. But these other things are just common sense ways to watch for people that might be experiencing some depression or anxiety, or in this case, some adjustment. I think you have to think about this now. Like, we're all experiencing grief. We've had a huge loss. Many people have lost jobs. They've lost income. They've lost their social contact. For a lot of your employees, work is their only social contact. You can't live by social media. And so when you take that away from people, they really do grieve the loss of their normal life. And the behaviors are a lot like somebody grieving a death in some ways. And I do think this is going to get a lot worse in that regard. I know a lot of business owners, I've talked to a couple already, that are very worried about that a month or 2 months from now. How do we re-engage employees? How do we integrate people back into the workplace? And we're building some tools to help you with that here as well. But those are things I would watch for. Obviously, if you've been in business, there's some things you can and can't ask. You can't look at an employee and say, hey, are you depressed? Not appropriate, but there's ways to ask questions and watch people. And if you're meeting with people regularly, whether by video or in person, you'll be able to, have your own little barometer and measure how people are responding. But you're going to do it. If you have I don't care what size your business is, we're all going to deal with this. There's just no way around it, because I see it happening already.
Can you talk a little bit about the resources that are available in the corridor to help people that are, really depressed or, heaven forbid, suicidal at this point? Can you just throw out a few resources that employers and business owners can tap into?
Yeah, there are several hotlines out there that employees can call for free counseling. There's obviously stuff out there, the suicide hotlines and things like that. God forbid we get to that point with very many people. The EAP programs are up and running. That's an essential service in healthcare. I know our EAP staff are ready to go. A lot of that can be engaged now by just straight telemedicine, so the technology supports all of that. And I would encourage you to take advantage of that. That's an easy way. People don't have to leave their home, so they don't have to worry about the threat to their safety. Those programs are up and running. The other thing that I think, if you get online, there's a lot of different charity organizations and other groups that are now providing support for people who have been displaced. I think the most immediate thing right now, when we've talked to employers and to patients, it's really understanding the financial piece. So any resources you have, if you have well-financed programming built into your benefit design, making sure that you're pushing that out to your employees, that's really, really important. But I would lean heavily on your EAP programs at this time. Most of your employees don't take advantage of them. I would argue you're going to see a big uptake in use, and maybe there you can flex that design offering or expand it at this time. Those would be resources I would look for.
So a couple questions from the attendees here. Can you talk a little bit about virtual doctors on demand, and how that process is evolving, and how helpful is that at this point?
Well, it's been amazing. And, all of you who've been at Corridor Business Journal events over the years know that I'm a big telemedicine supporter. Helped build our program here at Mercy and at Rockwell. And so it was amazing how overnight It took a catastrophe or a crisis to make it just explode. To put it in context, just from our health system as an example, we did telemedicine at Rockwell Collins, but beyond that, didn't have a real robust program at this point. In the last 2 weeks, we have done almost 3,400 telemedicine visits. So we went from a handful every day to 3,400 in 2 weeks. So for us, it's been an amazing piece of technology because we're not just using it for routine things. What we've really used it for is screening COVID-19 patients. And by that, I mean, when patients call our clinics, a little secret here, we're trying to keep sick people that don't need to be in the hospital away from the hospital, away from the clinics, because if every doctor's office in town gets filled with COVID-19 patients, you can't take care of anyone else. And so we've been using telemedicine as a screening tool to identify patients who, yeah, they may be sick and most likely have COVID-19, but we can do a simple exam by video, we can give advice, and we can closely monitor patients every day if we have to. And that's keeping a ton of patients out of the emergency room and the urgent cares where they don't belong. And so it's been amazing. And it's also been amazing the way it's been taken up by other specialties. We now have every specialty in our system using telemedicine in one way or the other. So it's been a godsend for us. If you look across the country, the same thing is happening. There's health systems where the use of telemedicine is up 7,000%. I mean, it's amazing. There's a lot of offerings out there. The way we do telemedicine is through your doctor, through your doctor's office. I know with some of the commercial available vendor products like Doc on Demand and Ameriwell and some things like that, there's a big demand around the country, but that means people are waiting for hours. And fortunately here with the programs we use here, that's not the case. People have a scheduled appointment. It works pretty easily. So we've expanded it dramatically. Patients are really liking it. And quite frankly, the average patient really doesn't want to come out of the house, and they really don't want to come to a doctor's office right now. Although we've used that as a way to keep our clinics what we call clean. We don't have sick people in our clinics right now. We see other illnesses that we see all the time, like urinary tract infections and back pain and chronic diseases and all the things we normally do. That stuff's fine. We've kept the really sick people and the people we think may have COVID-19. We've been able to keep them out of the clinics, which means we can keep everyday medicine operating to some extent. So we've relied heavily on telemedicine. I know many of you on the call have probably used it. Many of you who own businesses or do benefit design on the call have deployed these things. It's been amazing. I'm very proud of how we've been able to throw it out, and really proud of patients and how they've grabbed onto it, and they seem to enjoy it, and they've really grasped and understand how beneficial it can be. And I think, quite frankly, John, as we were talking earlier, we will never practice medicine the same again. We will use telemedicine in ways we never saw possible before because of this crisis. And that's a good thing. That's one good thing that will come out of this.
So a couple more questions from the audience. What would you say is best for disinfecting and cleaning when there isn't any actual cleaning products left in the store? Do you have a suggestion on that? And then kind of along those same lines, can you talk a little bit about how we can improve our immune system to fight the virus? Are there things that we can be doing besides eating vegetables and exercising that we ought to be incorporating?
Yeah, great. Those are both great questions. Let me take the one about health first. There's no doubt, whether it's COVID-19, other coronaviruses, influenza, whatever the disease, pick any disease. The better shape you're in, the better off you are. You're less likely to get disease. If you do get disease, you're less likely to have a bad outcome. If you've watched the news around COVID-19, a lot of the people that succumb to COVID-19 are older, but they also have other health problems like heart disease, diabetes, things like that. So when you go into disease and you're well, you do better with disease. As far as immune system, there's a lot of stuff out there. People take different supplements, different vitamins. Quite frankly, none of it's really been shown to work. Everyone loves vitamin C and zinc. I would argue there's no meaningful study out there that demonstrates it does anything. It doesn't hurt you. And the reason I like it is it means people are engaged and they're trying to do something for their health. The really important things, especially in the setting of viral illness, is sleep, stay well hydrated, and keep yourself healthy. Eat well. Unfortunately, when everyone's set at home and there's nothing else to do, we tend to eat. And this is why getting out and exercising is really important if you can do it safely. But the big things are rest, nutrition, and hydration, just like your grandmother would tell you. That's how you make your immune system strong. But maintaining health is critically important. The second question about cleaning, yes, there's a shortage on cleaning supplies. Even the commercial grade stuff that hospitals use is in short supply. If you get online, I highly recommend you be careful where you go. But if you go to the CDC and the Iowa Department of Public Health, there's some information out there about things you can do, other chemical bases you can use to mix products safely that you can clean with. And you got to be really careful with this. I heard the other day that there's some new stuff on Amazon that's available, that they're in stock. I looked it up. It won't kill this virus. So be careful what you spend your money on. There's a lot of people right now dumping product into the market, which won't do anything. So just be careful what you use. There's a whole list of compounds and chemicals that will kill this virus. The other thing I would stress to everyone, even if you have a good wipe, a Clorox bleach wipe, or you have Cavi wipes, or some of the alcohol-based wipes like we use in the hospital, those things work and they kill things, but it takes time. So if you were to wipe off a surface and then right away somebody touches it and use it, there still could be live virus. Most products take 1 up to 10 minutes to really do viral killing. And so make sure you read about that on the products you use, especially if you're cleaning things that need to be reused right away. The best way to get away or to not have to worry about not having cleaning products is you wash your hands. Because most of the surfaces become contaminated, not by somebody coughing or sneezing, by somebody touching things. And so if people are washing their hands, we limit a lot more viral spread. And washing your hands requires nothing fancy. You don't need an antibacterial soap. In fact, they probably don't do anything anyway. We know that now. The big thing with hand washing is lots of lather, aggressive washing for 20 seconds. Because what we're really trying to do is we don't kill viruses or bacteria with soap. The soap helps emulsify and pull that off your skin when you rinse. And so it's really about the time you spend cleaning your hands and then rinsing your hands. So even if you're at home by yourself, if there's any exposure in your home, if people come into your home or you leave once in a while, you should be really aggressive about hand washing. And be really careful. There's already terrible stories out there about people using bleach and other chemicals and having exposures. So be really smart about those things.
So a couple questions about how is an asymptomatic person infected with COVID shedding? That often isn't detailed. I don't know if that question comes across very clearly.
Mm-hmm. Yeah,
Go ahead.
They're shedding in the respiratory tract. So if they cough, sneeze, wipe their face, touch themselves, and then touch other things or touch you. So it's all about droplet spread from the respiratory tract. Now, there's a lot of discussion right now is this an aerosol disease? Meaning, yeah, I know that if I spit in my hand and I have COVID and I touch you, I'm going to transfer COVID to you. But when I cough, how long does that vapor, how long does that aerosol hang out in the air? And that's a very active point of research right now. We're trying to understand what that means because it's a big consideration for healthcare as well as public exposure. And I think this is a good time to talk about this because this is big in the news right now. This whole idea about masks and who should wear masks and which masks work. I'm a mask proponent. I believe in point source contact. For instance, I would tell my staff in the office, if you were stuck in a room with a COVID-19 patient who was sick and there was one mask, give it to the patient. It protects you better than you wearing it because it protects from droplet disbursement from the patient. So I believe in mask use, the cloth mask. There are some amazing people in this community cranking out masks by the hundreds. They are used within the health system. They're used in low-risk situations. When I wear my N95, my formal mask, when I see sick people, I actually dress it with a community mask to protect the integrity of my N95. I see more and more people out in town wearing masks. I believe in protecting your neighbor, and I think a good way to do that is if we're all masked. And I know there's dispute about that, but I fail to understand how that is harmful if we're protecting people. Now, it shouldn't give you a false sense of security because it doesn't protect you from aerosol and all the other things like an N95 mask does. But I do believe in simple masking. So those things are really important. And at a time when we're struggling to have enough cleaning supplies and different things, the better personal infection control we execute, the less cleaning we have to worry about.
So we're getting a lot of nice suggestions and links to Foundation 2 in Lynn County. as far as counseling and therapy. And so we'll do our best to post those on our websites when this
Yeah,
is
and
all
I'm sorry, I
done.
certainly didn't mean to leave anyone out. There's great resources here, and that'd be a great thing to push out to your employees to share as well, because they're going to need the help.
Right. So another question, we'll wrap it up here in a minute. The folks who test negative for COVID-19 but have symptoms bad enough to test, what do they have? What are some the bad things that are happening that going around right now?
There's probably still some influenza in the community, although because of the time of year it is, and because we've done so much social distancing, fortunately, influenza A and B have died off pretty good. You could argue that a lot of what we see now is still possibly just regular viral upper respiratory illness, which we see all the time anyway, and is always the most prevalent disease in the community. So that's possible too. If the patient is tested while they have symptoms, the test is pretty good as long as it was obtained in the proper way. So what I tell everyone right now is whether or not we think you have COVID-19 or maybe you have a different disease, we're kind of treating it the same, and the restrictions are the same. There's a lot of talk about whether somebody needs to be home 14 days or they need to be home 7 days. The recommendations from the CDC is you're home for 7 days from the onset of your symptoms. As long as it's been at least 7 days, you feel better, and you've been 3 days without fever, without using Tylenol or something like that, you can go back to work. We do recommend that when people go back to work, if they can, they mask for another 7 days. But that'll help prevent the spread of these other illnesses, these other viral illnesses, or influenza if it's still hanging around as well. So there's still disease out there. And so just, unfortunately, right now, we have enough penetration in the community of COVID that I think we have to assume if you're sick that you probably have that.
Right. So any other comments, Dr. Sagers, that you want to add with regards to, these stressed employees or stressed out business owners and people that are feeling isolated? Anything else that you want to touch on that you haven't done so yet?
Yeah, I mean, if you're worried about yourself or your employees, suggest they get help. I mean, make resources available. I think contact is a big deal right now. So if you can have these, even if they're twice a week video chats with their work groups, or as a supervisor or a leader that you're touching base with your direct reports, to have that regular contact. And routine is huge in times of crisis. The more you can make life like it normally is, and I know working from home isn't like being in the office, but those things we talked about earlier are critically important. We didn't talk a lot about this, but for those of you that still operate your business, you're still open as usual, you still have employees in the house, being really honest and open about watching for disease. If people are sick, send them home. Encourage people to leave if they're sick. That's critically important. The question we got a lot in the last few days from employers is, can I check temperatures on my employees? I highly encourage you, if you're open for business, that you screen your employees every day at the door, just like we do. Have you traveled? Are you sick? You've been around anybody who's sick? And check temperatures. You can do that. The EEOC passed a rule on March 19th, making temperature acquisition by employees completely legal. You just have to make sure you apply it to everyone, including yourself that walks in your building. But that's a good way to kind of keep an eye on people, let them know you care and that you're watching as well. This is going to get pretty heavy here. I mean, we have several weeks of this left, all of us. Just really, really keep a close eye on your people, and make sure they know there's help out there. Enhance your EAP, expand your EAP access, and those programs are here and ready to help.
Well, Dr. Sagers, thank you so much for helping us out today and shedding all that great information with our viewers. This has been being recorded, and so we'll have this available on our website. So anybody that viewed today's presentation, they can share that with friends and colleagues, because obviously this topic is not going away. I did want to just do a couple final comments before we officially adjourn. Our next webinar is coming up on next Tuesday, April 7th at 12 noon, and that's on how to do marketing during a crisis. And so you can go to our website at quarterbusiness.com for more information on that. And then our next regularly scheduled event is coming up on May 12th, and that's our Innovation Watch event. And we think we're taking that from being an in-person event to a virtual event. So stay tuned on that. And then for those fast-growing companies, nominations for that are due on April 17th. And then finally, I have been asked by a lot of folks how they can help the Corridor Business Journal during these times. And I think if you're not a subscriber to the CBJ, subscribing to our digital version is probably the best way to not only support us, but to also get a lot of great information from our news team. And so you can go to our website for that. So, and then lastly, if there's any businesses that are interested in sponsoring these webinars, please let me know. We're planning on, again, doing these every Tuesday and Thursday through the month of April. So let us know if you're interested in that. So thank you again for participating. Special thanks to Dr. Sager. Stay healthy and keep reading the Corridor Business Journal, and we are adjourned. Thank you.